Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am an alum. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie. On this month's show, we will talk about World Elder Abuse Awareness Day, commonly known as WEAD. Joining me for this important conversation is Mario Wawrzusin. He is the Senior Administrator for Assessment, APS, plus Care Management Services with the Montgomery County Department of Health and Human Services, Aging and Disability Services. Also joining us for this conversation is Debbie Feinstein. Debbie is the Chief of the Special Victims Division with the State's Attorney's Office in Montgomery County. Hi, Debbie. Hi, Mario.
Hi, Katie.
Hi, Katie.
Thank you both for joining us today. Let's just go ahead and kick this off. Many people probably never have heard of WEAD, and I would like for you to explain what that is and why it's important. And Mario, if you could do it from the services perspective, and Debbie from the legal perspective.
Sure thing. So World Elder Abuse Awareness Day started about 20 years ago. There was an international organization, the International Network for Elder Abuse Prevention. And they wanted to raise awareness about elder abuse, maltreatment, neglect, self-neglect, financial exploitation. So they worked with the United Nations, it caught fire, and Montgomery County joined forces. This is going to be our 16th annual event where we have a safety forum to inform our community and partners about some of our resources, some of the warning signs, et cetera.
Debbie?
As a prosecutor, we often get involved after the crime has already happened, after someone's been hurt or scammed, and events like World Elder Abuse Awareness Day are ways to get out in front, to bring prevention tools to the community, and that's why this event is so important.
You know, Debbie, Mario, many people, when they hear elder abuse, they think of physical abuse. But obviously it's much more than that. Can you both explain it?
Sure. So elder abuse, and actually in adult protective services, we work with folks that are 18 through 100 plus. But elder abuse or abuse of a vulnerable adult includes a caregiver or a trusted individual who's either doing something that harms that individual, or there's a neglectful act which leads to harm or could lead to harm. And Adult Protective Services is called, and then we will do an assessment, create a safety plan, work with our state attorney's office if there's criminal elements. But our whole goal is to try to keep that person safe. And so we're looking at not only physical and sexual abuse, which happens to be the slowest or the smallest area that we investigate. It's really self-neglect. Someone has Alzheimer's disease, they've had a stroke, they no longer can take care of themselves. It's difficult to shower, get dressed, get their meals, medications. We'll intervene, try to put in in-home supports and work with that individual and family if we can engage them. Financial exploitation is actually the second most area that we investigate. Then there's neglect by a caregiver, could be a professional. A lot of times it's a family member that's living in the home and is not getting the job done. And then of course the physical or sexual abuse.
Wow.
We can also see, and this isn't necessarily criminal, but it plays a part, we can see coercive control situations where individuals are using the dynamic between them. They may be, have more capacity than the person that they're abusing. They may be taking advantage of the vulnerability of that person, whether it's due to age or some other reason. And so we see cases that fall into that bucket as well. And oftentimes what we see is physical abuse or neglect going hand in hand with financial exploitation, because it may be to the abuser's benefit to have that person, have the victim kind of go downhill, if you will, or to deteriorate or decompensate, because that makes it easier for them to financially take advantage of them.
Wow. You know, Mario, you mentioned caregivers. So what should caregivers, community leaders, if there's a clergy member, some other family or relative, what are the warning signs that they should watch out for?
Sure, that's a great question. Well, some of the inherent risks with elder abuse is someone who has caregiving needs, they're more dependent. They might have early stage or moderate stage dementia. They live alone. They're isolated. So that puts you in a higher risk category, and actually females tend to be at a higher risk than males, at least statistically speaking. Warning signs for neglect: if that individual is no longer dressing appropriately for the weather, if they're never changing, if they're not getting out, if they're not attending faith community services or getting to the senior center, if on the outside appearance of their lawn, things aren't getting done anymore, if there's late bills, if there's new people showing up at the home regularly, and that person's not coming out as they used to at one point. Those are warning signs. They don't have the money to go to the lunch with the ladies anymore. Where's the money? So these are different things that a pastor could take a look at, or a clergy member.
In terms of reporting, Debbie, I'm just curious, how complicated does this get? Because if someone that is being abused, it's by their child or their niece, their nephew, how does someone report that?
Actually, most often, elder and vulnerable adult abuse is reported by someone other than the person that's being victimized. It's someone who notices the things that Mario just described, or notices signs of physical decline or physical abuse, unexplained bruises, that sort of thing, or a markedly changed emotional or affect, emotional state or affect. Their capacity has seemed to decline rapidly because it may be that they're not getting the medication they need, for example, and that can be a sign of neglect. But it really is incumbent on all of us to be looking for the signs. The kind of cases that come into my office are often reported by a financial institution, by another family member in cases of physical abuse and neglect and financial exploitation, maybe by a doctor, by a spiritual leader. So all different ways, but that's really the piece that I think people need to know about, is that it's on all of us in some ways, or in really all the ways, because the person that's being abused is not even going to necessarily recognize that they're being abused, and if they do, what we've seen in talking to victims, survivors of abuse and exploitation, is that there's a great deal of embarrassment and shame that they found themselves in this position, and really it's not their fault. Someone else is taking advantage of them, is controlling them. But talking directly to victims, I mean, that is, I'd say, the number one theme that we hear, is that they're embarrassed. We've had, professors and CEOs and people that are, have had these amazing careers, super smart, and they get into the situation, where their life circumstances have taken them that they never thought they'd find themselves in, and they're embarrassed.
Wow. Are there any other patterns that trigger reporting? And then my second question to that, you mentioned, banking institutions and, medical personnel. Are they required reporters?
The short answer is yes.
Okay.
Yes, they are.
Okay.
They are. They're mandatory reporters.
Okay.
And there's actually very specific laws that financial institutions need to follow, where individuals, is it 62 or 65 and
65,
up?
yeah.
65 and up. 65 and up, that there's very specific requirements that they have to follow with respect to reporting potential financial exploitation, and we get a lot of reports that way.
Okay.
And then in terms of signs, I think another big sign is to look and see whether your family member, community member, or friend is isolated. Are they not participating in activities that they had been participating in? And as Mario said, is there a new person in their life that may be dictating that? I'm thinking in particular of one case that we prosecuted a few years ago, where this woman lived alone, and her neighbor ingratiated himself to her, and her other neighbor, noticed all the things Mario was describing. The house was getting to be in decline. The defendant had actually boarded up her window so nobody could see inside. No one had seen her or heard from her, and they used to hear from her all the time, see her outside. So looking for these changed patterns is perhaps the most significant thing, and the clearest way to identify that something is not going on, is going on that's not okay.
Changed patterns. Are there any other behavioral or emotional changes that you want to uplift, Mario?
Well, first of all, I just want to confirm and reinforce the fact that most of our referrals are not from the older individual themselves. So it does behoove the community and professionals to report. The mandated reporters in Maryland are healthcare professionals, human service professionals, law enforcement, financial institutions. So we do count on them, but we really count on everyone. It's critically important. So In terms of some of those warning signs, I don't want to lose the question here. Yeah, the change in behavior. If you do have an opportunity to meet with that person, but they're with their caregiver, this new caregiver perhaps that's just moved in, but they're fearful, they're looking away. Those are signs that there's something going on there that isn't quite right. So at that point, you can make that call to Adult Protective Services. I'll be happy to give you that phone number.
Okay, okay.
But our local number is 240-777-3000. And then we have clinical professional social workers, many of which were Adult Protective Service investigators, and you can provide all the concerns, the facts, the W's, who, what, where, when, and then we'll work with that individual and assess if we should send out a team or a social worker to investigate.
And Katie, can I add one thing to that?
Debbie.
I would say to the community to err on the side of reporting. If they have a concern, report it. At worst, it'll be something that gets looked at and ruled out by Adult Protective Services. But if you have a concern, don't hesitate to report it, and you can talk it through, and you don't have to make the decision as to whether something's wrong. Adult Protective Services will do the follow-up.
And that report is actually anonymous too, so
it's good to know.
Yes, right. So the client or individual might ask, but we're not going to share that information.
Some people might be afraid or apprehensive to report because they don't want to be necessarily identified or associated with telling their truth.
A lot of times they don't want to damage that relationship, be it friendship or family member. So we respect that.
Let's keep that same vein. So it's we talked about this a little bit, Debbie, difficult when it comes to family relationships. That's a very hard truth, that it's likely somebody very, close to you that's engaging in this bad behavior. So how difficult is it, if we can just talk about it a little bit more, to report that? I'm just thinking, if it were my grandmother, and let's say my uncle was doing, this is not happening, but was doing was engaging in elder abuse as his niece, that's a very hard position to put me in for two people that I really care about, love. I've grown up with them, I know them, I have my own personal view of him, and I'm actually shocked at how he's treating my grandmother now. Talk a little bit more about that.
And I think a lot of families try to navigate that on their own under those circumstances, to try to deal with it within the family. But a lot of times that's not going to solve it, particularly when it's insidious or long-term. And authorities have to get involved. Now, just because Adult Protective Services gets involved, it doesn't mean that law enforcement or my office get involved. We meet collaboratively to discuss those cases, and what the family wants is something that we take into consideration when trying to figure out what path to go. So reaching out for help is often necessary, but not always done, if that makes sense. And then that may prolong the abuse. So in your example that's not real, it may be that it makes it even more unsafe for your grandmother if you all start to confront the uncle, or your uncle doubles down, wants to get the money faster because he is afraid that he's going to be found out. So intervening with open eyes and also knowing what the resources are and having them at your fingertips is critically important.
Okay. Mario, what happens when Adult Protective Services receives a call? So someone notices the behavior, and now you all have received the call. It's anonymous, but from there, what happens?
Sure, we'll let the reporting source, the person who called, know if we're going to investigate that situation or not. And we'll gather more information. The investigator, once assigned, will gather more information, perhaps from the referral source. But then they're going to go out and meet with the client and their living situation, their home. Assess how they're doing medically. Is there enough food? Are they getting to the physician? Do they have their medications, and just in general how things are going, and working with that client, develop a safety plan. Our goal is not to move people out of their homes or into nursing homes. That's a myth. Most of the time we're helping with some in-home supports. And if there's a caregiver that's neglecting or taking advantage financially, because that money is for their care, not for someone else's needs or desires, we're going to intervene. We have different tools. We'll consult. We have a monthly meeting with the Montgomery County Elder Vulnerable Adult Abuse Task Force, which Debbie has been chairing for some time now, and she's a fabulous chair. So we will meet and we'll come up with a plan. We'll work collaboratively to protect that client, because that's our primary concern. But we'll work with positive, supportive family members as appropriate.
You know, Mario, I can see a number of different scenarios happening, and I want to get to Debbie to see at what point, after, Adult Protective Services take the call, your office, the state's attorney's office, gets involved. We're in a similar scenario, not true scenario, but similar scenario. If a grandmother or an older adult, what if a family member makes that call to your office? And then you all start the investigation, but that older adult is resistant to help, because I'm sure that probably happens more often than we think. What do you do?
That's a great question. It does happen. So that's the advantage of working with licensed clinical social workers. We're very experienced, our teams. We have 3 teams. We also have a couple of nurses that we can bring out. So we try to break down some of those barriers and work with the client and show that we're here to help bring in resources. So that's one of the things that we do. Another piece of this, though, is we do need to assess for an individual's capacity, ability to understand how things are going, to make decisions medically for themselves. Perhaps there is mild cognitive deficits or some kind of dementia. Under those circumstances, we have other tools that we might use, and we try to do things in a voluntary sense, working with that individual. Like I said, positive contributing family members will tap that resource as well. But if there's capacity issues, then we have another tool as a public guardianship route that we could possibly take to ensure that that person's going to get the food, the medicine, the care that they need. And if there is someone in the house that's blocking that, a caregiver, family member, we're going to have that discussion with our law enforcement partners, and they would in fact assign a detective to work with that situation. And so we'll work with them, and that certainly can help.
All right. Law enforcement.
And just to piggyback on what Mary was just saying, those are the kind of conversations that we're having not only monthly at our official task force meeting, but on a regular basis. So within the state's attorney's office, we actually, I was introduced as the chief of the Special Victims Division. One of my jobs is I'm co-chief of our Crimes Against Seniors and Vulnerable Adults unit, acronym CASFA, and that unit has a full-time team member, staff member, who runs the day-to-day, and she's in constant communication with Adult Protective Services. So we're actually evaluating these cases on a real-time basis. We also are in constant communication with law enforcement. If they get a report, we're reviewing those in real time to sort of decide which resources to bring to bear at any one moment in time. So a more obvious situation is someone's in physical danger or someone is injured. That's nobody's getting the state's attorneys involved immediately. What's going to happen immediately is you would hope that 911 is called and there's emergency care provided that person. The medical needs need to be met. But in a lot of cases, we're seeing particularly financial abuse and neglect. Those happen over a longer period of time. They're almost more insidious in some ways because of the effort that it takes to hide those things that are happening. But we'll get involved in a myriad of different ways. A direct call from Adult Protective Services, when I say call, I also could mean email or any other way, or from law enforcement directly. We also hear directly from the community. We'll get calls directly to our office, which people are welcome to do, to report the concerns that they have. And circling back to what you asked about, if the person that is being victimized is reluctant, we see that all the time. And that's when it becomes particularly important to bring these wraparound services, this multidisciplinary approach. Law enforcement's not going to be banging down their door. We're going to be trying a softer approach to try to engage them. And really, as Mario said, if the person doesn't have capacity to make decisions for themselves, then there are additional tools that can be brought to the table. And the county attorney's office works on those public guardianship cases.
Okay. You both mentioned that so many cases go unreported. And I know we talked about earlier, Debbie, you mentioned shame was a huge, part of that, because many older adults have had stellar careers, and again, the CEOs, the teachers, I don't know, county executives, government officials, just have been in a number, or private sector, right, have been in a number of great careers, but are embarrassed. Are there any other reasons why it goes unreported, aside from maybe people being fearful of, I might get arrested?
Well, I think there's concern about getting law enforcement involved, fear of what that might look like. There also can be cultural barriers. By cultural barriers, I mean that you're not supposed to. It's shameful to report outside of your culture, and people may go to their spiritual provider or someone within their own community for help, and we would hope that they would do that also. But sometimes things are kind of kept internal. There also may be financial pressure, fear of losing the stability that they have if they are to report. For example, if they're living with their abuser, what is their living situation going to look like? Is there another family member that they can rely on? And all of those pressures come to bear. And then there's just the basic fear, am I going to be hurt more if I report this, or if I tell about what is happening? Because they may be threatened. They have been sworn to secrecy. There's so many power and control dynamics that are at play. Not that different than what we see in situations involving like intimate partner abuse, domestic violence, where you see this disparity in power because the family member or the caregiver has the power. They're making sure there's food, medical care, housing, potentially transportation, and angering that person or reporting that person could tip that balance, in their minds in a way that makes them even more unsafe.
Okay. I want to ask this question, Mario, and I want to be very careful because Debbie mentioned cultural competency. And as I'm being careful, I will say that it appears many communities of color might have some issue with reporting. I know that you have licensed clinical social workers. How does that play out in their day-to-day work once Adult Protective Services gets a case?
So we do have a diverse staff that works in Adult Protective Service, which I do think helps, and a number of staff that are bilingual as well. So we also do a lot of outreach to various parts of the county, different communities. And we just want to show them we like to work in collaboration so they can see Adult Protective Services, State Attorney's Office, and I know the State Attorney's Office does a lot of outreach on their own as well with law enforcement and other partners, ombudsman program and so forth. So we want them to know we're a resource. We respect how that culture handles issues, but when it gets to a point where someone's put at harm, we want to make ourselves available to them. And I think the best way to do that is to get out into the community regularly, and we are getting out regularly to do so.
Thank you for that. Financial exploitation, you mentioned that too, Debbie, as a primary that happens alongside of the physical abuse. Are there any recent stories that you're able to just talk about that have happened?
Well, I think, you pick up the news and you can see all sorts of scams that are out there. So there's the sort of the scam piece, and then there's the direct exploitation.
Okay.
So speaking to the direct exploitation first, that is what we see and are able to address most commonly. That is the example of the family member who's siphoning money or using the assets of their grandmother for their own benefit. So it may be that the family has set up, okay, the grandchild is going to take care of grandma and be in charge of her resources and her checkbook and paying her bills, but what's happening is that the grandchild is, buying a new car and going on expensive vacations and ordering all sorts of clothes. So, that's kind of that's direct financial exploitations. That's sort of how I think of it. And then similar to that is obviously the physical and the sexual and the neglect. And then you have scams. That's really where an outside source, company, bot, someone from overseas is taking advantage of someone through various scams. You know, some of the prime examples that we see are like a romance scam, forming a relationship with someone who may be lonely, and convincing them that, you know, essentially this is the love of their life, and then building that, kind of grooming them. And then much in the way that we talk about with child abuse, you know, grooming someone and getting them comfortable enough to get to the ultimate goal of the scammer, which is to get money from them. You know, I love you and I want to see you, but I'm stuck in whatever country. I can't get to you unless you send this money. Or you love me and I'm housing insecure, or I'm having an issue with food over here, or my family is suffering. Please send money to take care of us, and then we can be together, or whatever in that way. So that's a common scheme that we see. We also see schemes that happen over the phone, schemes and scams that come through a pop-up on the computer. You know, something pops up on someone's computer that says, you know, your network is in danger, you know, you've been invaded by blah, 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 click on this button and we're gonna help you, or you're gonna lose all your money in your bank account, or some variation on that theme. And for someone that may be, you know, someone that may be in all other ways okay, they may have a blind spot for that and have that fear, because these scams are designed to get at that, you know, that fear factor, to make someone feel afraid that something wrong, whether it's there's something wrong with their bank account. People get phone calls that their niece or nephew are in jail and they need to send money right away to get them out of jail. You missed jury duty. You need to pay this money in order to avoid something worse happening to you because you didn't show up for jury duty. It's all playing on that fear. And we see that, unfortunately, way too often.
Okay. This conversation went by way too fast. I have 1 minute left, and there's so much I would like to talk about, like how can older adults take steps to prevent elder abuse? How can they do that themselves? We want to talk about technology, but what's more important, what is Montgomery County doing right now? Is there going to be an event that will observe WEAD?
Sure. So for the 16th year, we're having an Older Adult Safety Forum, World Elder Abuse Awareness Day. That's going to be on Wednesday, June the 17th, from 10 to 11:30 at the Schweinhaut Senior Center off of Forest Glen Road in Silver Spring. And Debbie's going to be our keynote, working with the State Attorney's Office. And we'll have many resources, resource tables, great information. In fact, the older adults are going to be doing some skits that will show we're recording those, or they're recording them, working with us on some of the warning signs and some of the things that folks should be aware of in terms of elder abuse and maltreatment.
And there'll be resource tables, lots of resource tables for people to come and, you know, get a bag and fill their bag with the resources so they can have them literally at their fingertips. There are local resources, there are national resources. You can go to the state's attorney website to click on some of those, the FTC, you know, the Federal Trade Commission. You can go to Adult Protective Services to learn more. You can just Google it and information will pop out. But we really hope here in Montgomery County to provide local specific guidance, and that's what we're available to do, and that's what we want to show at World Elder Abuse Awareness Day.
Wow. I have no doubt that it will be a great event. People will hear from amazing speakers who have a lot of knowledge and expertise on the subject matter. Is there anything else that you would like to share that I didn't ask in a question that would prompt a response?
I'm good.
I mean, I think just to circle back to the critical piece, which is if you see something, say something. You know, if you're worried about a friend, a neighbor, you know, a community member, just make an anonymous call. We'll talk you through it, and you know, we can all really participate in protecting each other.
Thank you so much. Thank you, Debbie. Thank you, Mario. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.